The summer heat is here, and the sun can feel wonderful on your skin. While getting a tan may be at the top of your mind when relaxing at the beach, protection is the key in preventing cancer, painful sunburns, and premature aging. July is UV Safety Month, and the Mary Bird Perkins Cancer Center at TGMC wants to discuss how to stay safe under the sun this summer.
And welcome to Your Health with Terrebonne General Medical Center. And joining us now, Dr. Doria with the Mary Bird Perkins Cancer Center at TGMC. And Dr. Doria, welcome to Your Health with TGMC.
Thank you.
And we're talking about UV month, if you will, but explain to everyone what UV rays are.
UV are the harmful type of rays from the sun. There are two types of ultraviolet rays, the A and the B. The UVA are the ones that cause immune suppression. The UVB are the ones that cause the sunburn.
Okay.
So you have to, differentiate a little bit in between the two, but both are the ones responsible for skin cancer. So when you're talking about protection, you have to be protected against both if you want to prevent skin cancer.
Okay, so how do we stay safe from these UV rays?
Well, the most important thing is avoid them if you can, as much as you can. The important thing to keep in mind is that they're at the most powerful effect from 10 to 2 in the afternoon, 10 in the morning to 2 in the afternoon. And you have to limit the time that you're exposed to it. If you have to work outside or you're going fishing and you're going to be exposed for a long time, just make sure you protect yourself. Wear long sleeve, a Mexican hat, and things like that. Just protect your skin. And if you're going to be exposed and not protected, make sure you have the right sunscreen.
Okay, you mentioned sunscreen. What type of sunscreen should one pick?
They're an evolving area from the FDA, and we're going to talk about that a little bit later. But you should pick a broad spectrum sunscreen, the ones that will protect you from ultraviolet A and ultraviolet B sun rays. And they should be water resistant or sweat resistant if you're going to be swimming or you're going to be sweating a lot. And it should be of high SPF, much better if it's 30 or greater, and you have to reapply it every 2 hours.
Okay, every 2 hours, and is that regardless of the SPF number?
Exactly. The common misconception is that if you use a higher SPF, like 50, you're going to be protected for 8 hours, and that is not correct.
Okay.
No matter what SPF you use, the duration is 2 hours, and you have to reapply it every 2 hours to have good protection.
Okay. Let's talk a little bit about the new federal, the FDA regulations about sunscreen and SPF.
That's important because it's revolutionary. We were a little bit confused about SPF, what's 50, what's 30, and they're coming now with better labeling. What they're doing is they're saying all the sunscreens have to be broad spectrum, and broad spectrum means they're protected against ultraviolet A and B, which are the two harmful sun rays. And they also taking off the labeling of waterproof, sweat-proof, and they're if they are resistant to water, they're calling it water resistant.
Okay.
And that means that if you're sweating a lot or you're swimming, it will give you protection for about 2 hours.
Okay.
If they don't have the level of water resistant and you swim, you don't have any protection when you come out of the swimming pool. Or if you sweat a lot doing any kind of sport, it wash off with the sweat, and you're not being protected at that point.
Okay.
So those things are important, and the important thing to keep in mind is skin cancer prevention, and they clearly now saying that if the sunscreen is 15 SPF or higher, they prove that you're going to be protected against skin cancer. But if it's lower, like 4 to 14, you're not going to have protection from skin cancer. You may have protection from sunburn, but not from skin cancer.
Oh, wow. That's interesting. Let's take a short break. When we come back, we'll elaborate more on skin cancer. Joining us, Dr. Doria with the Mary Bird Perkins Cancer Center at TGMC. We'll take a short break. When we return, we'll continue with To Your Health with Terrebonne General Medical Center.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
I'm very involved at Trinity Episcopal Church. My first experience at Mary Bird Perkins convinced me what a fabulous facility it was. The technology is state of the art. I know that because I was treated for a brain tumor on my optic nerve. My name is Cheryl Lane. I knew I needed to be close to my family, my friends, and my church. I'm thankful we have Mary Bird Perkins in our community. It's such a wonderful asset.
Mary Bird Perkins Cancer Center at TGMC.
All right, welcome back to Your Health with TGMC. Joining us, Dr. Doria with the Mary Bird Perkins Cancer Center at Terrebonne General Medical Center. And we were talking about skin cancer and sunscreen and FDA regulations. Before we get into what skin cancer is, Doc, the American Academy of Dermatology has come out with some seals. If you can talk a little bit about that for us.
Sure. The American Academy of Dermatology created a foundation they call the Skin Cancer Foundation, and that's a committee of experts that came up with this seal that is going to be in all the products that are approved by this foundation. You're going to have products that they're going to have the daily use. That's for the routinary exposure of sun exposure when you go out in the street and you're exposed for a short period of time. They're cosmetic, they're going to have this seal, and there are going to be sunscreen that are going to have this seal.
Okay.
And the active seal is going to be for the more prolonged exposure, like when you go to a sporting event or go fishing, things like that. These are going to be in all the products that are approved by the Academy. It's separate from the FDA.
Okay.
This Academy has a group of scientists that actually prove that if the product says that is SPF 30, they scientifically prove that it has all the chemicals and it's really an SPF 30.
Okay.
And if it's if the FDA claim or label it water resistant, they prove that it's in fact water resistant. So that's the benefit of having the seal.
So when you go and buy a bottle of sunscreen, you won't look for that.
You want to look for that. The FDA already start applying these changes in most of the product, but there are small companies that actually are given about a year to start changing. So you're not going to see that right away. You're going to see it in the biggest, most important pharmaceuticals like Avon or that kind of product. But in the smallest companies, they probably take more time to start changing it. But eventually, in a year, all the products are going to have a common approval.
Let's talk about skin cancer, because it's UV ultraviolet rays safety month. What actually is skin cancer?
Skin cancer is the uncontrolled growth of skin cells. Like when we cut ourselves, we have a scar. It's at the beginning, you can have a little bit raised, scarred, but eventually it will level off. The skin cells, they can control their growth. They know that when it gets to a certain point, they have to stop growing. That control is not there for skin cancer. There are abnormal cells that grow with no control. And one of the reasons is genetic mutations due to exposure to ultraviolet rays.
Okay, so are there any other causes for skin cancer?
There are other causes. The most important one, 90% of the non-melanomatous skin cancers are primarily due to sun exposure. And about 65% of the melanomatous skin cancer are due to exposure to sun. But there are other risk factors like tanning, that's ultraviolet exposure that is not sun rays, chemicals like arsenic, and genetic conditions that, they're rare, but they're causes of skin cancer.
All right, and are there any symptoms that we can be on the lookout for skin cancer?
Any lesion in the skin could be skin cancer, but there are primarily two main types of skin cancer, and one is the basal cell skin cancer, which is a waxy type of pearly lesion that you can actually develop anywhere in skin exposed areas. So they're less frequent in the trunk, but more frequent in the face, in the palms, in areas that are exposed frequently to the sun. And the squamous cells are more firm lesions. They're also in all the skin exposed to sun areas. And the most feared one, but less frequent, is melanoma. Melanoma, we all seen pictures of a mole-type hyperpigmented lesion with irregular borders. Sometimes can, scale and can bleed. They have different colors. Sometimes could be looking blue-looking center. And those are, if you see any of those lesions, have to see a dermatologist right away.
All right. We had on the screen some factors that increase the risk of skin cancer. If you can go over those for us.
Sure. It's well known that fair skin people from north moving to tropical areas, they have increased risk of skin cancer. Sunburns, especially early in age, anywhere between, a teenager time, which is the most frequent time where we tend to get sunburns. Excessive exposure to the sun, and this is important for the workers out there. construction workers, they think that because they're already tan and they've been exposed to sun so much that they're protected. Tanning doesn't protect against UV. It protects against sunburn. Maybe you're trained and your skin is adapt to the sun, but it's not protected against developing a skin cancer. So they should use sunscreen all the time.
Okay.
Moles, family history, and important for those with a weakened immune system, those that have treatment for cancer, bone marrow transplant, they really should protect their skin with sunscreens. Okay. And for people that work in chemical plants, certain chemicals, they have to make sure they know the chemicals they're exposed to. If they ever direct exposure, they need to make sure that they clean it well. Okay. If it's a chemical that is known to cause skin cancer.
All right.
And increasing age, of course, that's because the time the skin is exposed to the sun.
Okay. And when should I be screened for skin cancer?
Any kind of lesion that looks abnormal should be screened, especially if an elderly individual that has a lot of keratosis lesion. They're very normal, benign looking. If they see anything different than that, they should be seeing a dermatologist.
Okay. And other than what we've talked about, any other way to reduce the risk of skin cancer?
Well, the main thing is, again, to avoid prolonged exposure, especially during the times of the day that we talk about. Use clothing, use important thing that we didn't mention, glasses, sunglasses. Okay. With UV protection, because the retina also is exposed and can develop melanoma.
Okay.
So sunglasses is important, big hats, and sunscreen.
All right.
It's a skin prevention month. You can't, here, especially here in South Louisiana, you can encourage people enough to use sunscreen.
Well, Doc, this is a very important issue. For more information on skin cancer, where can people go?
They can go to first any local dermatologist, but also if they want to have more information from the webs, from the internet, they can go to skincancer.org, and they'll give you an up-to-date information about all the things that are going on with the FDA, the sunscreen, and other things to do to prevent skin cancer.
Dr. Doria, that's very informative information and very timely as well, and we appreciate you being here.
Thank you. Thank you for inviting me. It was a pleasure.
Yes, sir.
Appreciate it.
All right, that'll wrap up the 2-Year Health segment with Terrebonne General Medical Center. We'll take a short break. We'll have more for you tonight on Bayou Time.